people have been sending me messages about complex PTSD or different types of trauma. And I'm not sure that everybody's always aware that there's kind of many types of trauma and different criteria and different symptoms. So we have PTSD, which is usually from a singular event, not necessarily exclusively, and the symptoms have lasted for more than over a month since the traumatic event. And then there are other symptoms you can have a look at that come under PTSD. And then we have complex PTSD created by Judith Herman. And complex PTSD is really about the repeated exposure to trauma, usually in early childhood. So it can be like child sexual abuse, it can be witnessing domestic violence repeatedly in early development, and it can be, for example, war. Then we have things like early relational trauma, which is about trauma in the early system between parent and child, and it's like a dyadic system, so it's the trauma that happens in the relationship. And I guess in that, when things go wrong, we can think about intergenerational trauma. We can also think about the neurobiology of attachment and trauma that happens if needs are not met. And then we have developmental trauma by Van der Kolk, which is trauma that occurs in early childhood. And I've also talked about vicarious trauma that happens from listening to someone else's story of trauma and exposing yourself to the trauma through that. And then there is the idea of dissociative identity disorder, which also causes a trauma to the self and many different levels of self. So that's another aspect where trauma has occurred. So I think it's worth noticing when people talk about trauma, there are other types of traumas. And I think I really wanted to do this because people have been sending me messages about complex PTSD or different types of trauma. And I'm not sure that everybody's always aware that there's kind of many types of trauma and different criteria and different symptoms.